Hey, everybody. Thank you again so much for joining us today on another episode of Coro Chronicles. We were just having a little bit of a chat before we started the podcast, and I have to say, I connected with Jim a couple of weeks ago, and I noticed that a couple of my guests, and I love all of them, but I was seeing a little bit of some similarities. So I thought I needed to find someone that was a bit of a disruptor, someone that was like had a completely different lens. And so, yeah, so my friend Jim came to mind. And Jim, why don't you, because I know no one can do it better, introduce yourself to our audience and a little bit about your background.
Well, I love the word disruptor, right? That's a great way to start it off. So I hope I live up to expectation at that point. But yeah, my name is Jim Conti. I am currently the vice president at Vantiva with a product we call HomeSight. And we're bringing technology into the home care market and utilizing technology to see how we can impact people's lives. Folks want to thrive in place. They want to stay in their homes longer. And we believe by using technology, we can help them do that and help their care providers, their caregivers, whether it be a public or a family member or a private care provider company. Utilizing technology gives them some tools and some data points to help them to be proactive, to have a safe and secure environment, and give families peace of mind that their loved ones are thriving in place and are in good shape.
It's very interesting. I love this topic. Like I said, you're bringing something a little bit of a different lens for our audience. But it is a sidebar conversation that as I am maturing, I'm having not
Mm,
only with my parents, and my sister and I are having conversations about this, but my friends.
yes.
And it's like they're struggling and having conversations because it used to be back in the day that an aging parent would either automatically move into the adult child's home. And
Yep.
sometimes you'd have very much so different generations underneath one house, or one roof. But then it's also been where then maybe over the last, well, let's just say 20, 30 years ago, then it became where our generation kind of started to move around, or our parents' generation started to move around a little bit. So, like what my mom experienced when my grandfather had already passed away, and my grandmother needed support. My mom just moved her close to her,
Yep.
but she wasn't in her home. She wasn't in her community. I mean, all of that.
Yep.
So I love the conversation now because people do get a little bit scared when you start talking about technology as a care tool,
Yes, of course.
but it does. And I want you to kind of share maybe some stories, because I'm always one of those that facts tell, but it's the story that really kind of sells the message and the mission. But give us like a few examples that you can think of being able to help an adult child with their parents, or a story of someone that you know that you, because of you guys, that they got to stay in their home, or they're still in their home
Yep.
right now.
Yep. Yep. I wish I had just one. And what's amazing to me is that when you first start talking about technology, and you're spot on, that people are afraid of technology. The word technology means, and to this generation, it's a scary thing. But we
Mhm.
chose the TV as the way to utilize that for the means of communication, which is a not, I'm very accustomed to it. People now have 50, 80-inch TVs in their home, sometimes multiple TVs, and they spend quite a few hours, as they do now, watching TV. They get their news, they get their information, they get all that from it. So we utilize something that was not scary and that was
Mhm.
available and readily available, and didn't have to make any major changes. You don't need another device. You don't need to change the way you did things. Hey, I lost my iPad, or I can't find my
Mhm.
phone, or I don't have a smartphone. So the TV was something that was very common. And so we started down that road. And to your point of asking about, how technology can impact people's lives, it really starts in the beginning of that care journey. And we all have one, right? So today, right, they're still ambulatory, they might be driving, they still
Mhm.
might be right? Out and
Mhm.
around and not quite feeling like they're ready for that type of situation. Some have
Oh,
moved into those over 55s as a way to kind of bridge the gap. But
yeah.
that means they're moving to potentially a city that's not close to any of their loved ones, right?
Mhm.
Florida or Arizona or some of those other markets that are seeing an influx of seniors going in. Like Florida, for example, right? You might have loved ones living in Florida, but kids nowadays might live all over the world. So in the beginning of that care journey, how do we connect the families to the loved ones? Because loneliness is probably one of the single biggest things that we
Oh,
address right out of the gate. It's a
yes.
scary thing, and I was not aware of how much of an impact loneliness has. And I work with a lot of professionals that have indicated it's like smoking several packs of cigarettes a day to their health. I
Mhm.
mean, it's that detrimental to feel that loneliness as they're trying to stay home. So we can utilize technology to help make that connection. And it doesn't matter where the families are, they could be anywhere in the world. And one of those examples is that unfortunately we run the whole care journey, but we had a woman that was passing away and she had a home site on her TV, and she was able to have her kids on her TV. And they were sharing
Mhm.
stories and singing songs, but they were all
Mhm.
connected in this technology interface. And she passed away with her family in the room, even though they couldn't be there.
Wow.
So when you
Wow.
start, really, that is quite, when you start thinking about how what you do, we're not selling a box or a widget or you're
Mhm.
selling something that really has a significant impact on somebody's life. And that care journey starting out just loneliness. I mean, if we could do a great job of impacting that, I think we've done our job as a company. But that journey doesn't stop there, right? People start to move through that journey where there's now an event, there might be a fall, there might be
Mhm.
dementia onset, or there's various things that happen as they move through the care journey up to, unfortunately, including hospice. And we can impact them and customize the care plan as they go through that journey. So our ecosystem now of technology allows us and allows the caregivers to provide very different care in a very different way to monitor what's going on with mom and dad. Things like monitoring biometrics. Just I can monitor weight, I can monitor blood pressure, I can monitor blood oxygen. We can do it all remotely. Caregivers can do it or family members can do it, and they don't have to physically be there to take the test. They can do it over technology. And now we actually had a case where we actually got involved. We mitigated a situation with a young woman that was going to have a stroke had we not been monitoring her weight. So you see how at each stage there's a different way we impact somebody's life. And I always laugh because I always say, I'm going to share these stories with you, but you're going to say, hey, Jim, you know what? You're going to say that, right? That's your product. You're going to say it. But
Mhm.
we have multiple caregivers that have provided those testimonials and those case studies to us. And when you hear it coming from the very people that are providing that care, it's very powerful. And we are so blessed to have the ability to impact people's lives that we work with them now very closely to create a product that works within their ecosystem for their caregivers, for the ones that they're taking care of. And that includes things like we can add cooking sensors for somebody that's got a dementia case and forgot they put a pot on the stove and walked away. Imagine being able to now remotely shut that off or have the stove shut itself off, or being able to adjust the thermostat in somebody's house. Now, we can do with sensors, see the temperature in somebody's home. But we had a dementia client, care recipient in New Jersey, that put her
Mhm.
thermostat down and she just didn't remember to put it back up. It was in the middle of winter. So she went to bed and wasn't going to get out of bed because it was too cold. Now, had we not had a sensor in our home and somebody monitoring that, we would have never seen the temperature in their home. They sent a caregiver out, adjusted the temperature, and averted something that could have been much, much different outcome. And we want to take it to the next step. Now give the caregiver or the family member the ability to adjust that thermostat
Mhm.
remotely. Now,
Mhm.
people have that in their homes today. They have smart technology, smart
Mhm.
lights, smart
Oh,
plugs, smart thermostats. This technology exists. It's not novel. We're just going to build this single pane of glass concept that allows the caregivers to put in various sensors for the things they're trying to monitor. So the biometrics, right? The weight and the blood
mhm.
pressure, the smart sensors, we can monitor temperature and leak detection, right? You ran a bathtub, walked away, forgot about it. Well, we can
Yeah,
help.
yeah.
Smart locks. We don't need keys anymore. I can let caregivers in,
Mhm.
dog walkers. People have a fall. We're trying to mitigate with fall prevention, not necessarily fall detection. And we have like toilet flush sensors now that we can start to watch things like UTIs. So maybe get ahead of that and
Oh, yeah.
proactively come up with that solution and stop it before it becomes something much bigger. And then, of course, working with folks like Coro Health and others, we're adding a content piece to
Mhm.
our ecosystem. So now we can provide information, videos, they can share videos, they can read about nutrition, they can do their Zumba classes, they can connect with others. So there's a way to utilize content from engagement with the caregivers. They can do dementia gaming to keep their mental
Mhm.
alertness. So all of that rolled up into something that we can customize and personalize to the particular situation that we're trying to manage and monitor. At the same time, again, coming back to the beginning, making the environment safe and secure so that families have peace of mind that their loved ones are being taken care of.
I know, and it's so funny because I keep hearing this element of peace in being able to provide that. Because as adult children, I mean, you're constantly like our David, our founder and CEO, like
Yeah.
he's taking care of his father at a distance. And there's been times we've been in the middle of a meeting and I see him grab his phone and there's an alert and he's like, I'm sorry, I've got to go and
Yeah.
stuff. And it's just because of different things that occur, but it's just he lives in a little bit of a sense of almost the expectation of like, it's not if, but when I'm going to
Yeah.
get a phone call because something's occurred. And I
Yeah.
started thinking when you first said starting off with a TV. And the first image that popped into my head was my grandmother's Magnavox TV. And it's funny that we talk about technology because I remember the days they had never had a TV. And I remember like her talking about the story of when the TV was brought in and how it expanded her entire world.
Yep.
And my grandfather was just so proud because they had saved up so long to buy this big, huge thing. And but it was something that opened up, and then it became part of their life. That
Yeah.
when they wanted to know what was going on with the world, they weren't picking up the newspaper. They were going to their trusted friend, which I believe
Yeah.
was Walter Cronkite. And then even years and years later, when that TV broke down, it became the TV stand for the next TV because then they couldn't live without it.
Yep.
And so when you're talking about meeting people where they are and where they're comfortable, now that you're saying this, it makes complete sense. And then now with all of these features and things that you're talking about and what your ability is, it's one, I'm looking at it now from being that adult child that's going to need to get eventually, I will, it's not if, but when I'm in that place with my parents. But then I also think about it for myself. I think about what my son and my daughters are going
Yep.
to, how they're going to be able to help me
Yeah.
and everything. And we can also start having those conversations now versus for a lot of families, they're having that conversation more of a reaction or being reactive versus proactive. That's one part that I love, like even having these conversations with you. But there is something I have to dig in, and you and I had talked about this a couple of weeks ago. But obviously, you're sharing the story, and yes, this is who you work for, so forth. But I want to know a little bit about your journey and then a little bit about how you got here. Because
Hmm.
there's definitely a passion that comes across, and you definitely understand what it is that you're able to offer when it comes to the company you work for. But I want to dig into that part that's
Sure.
starting to spark up. And I know that just has to come from your story.
Yeah, it is a unique journey, and it started out many years ago, and I'll date myself back to I first got my technology baptism through paging. All right, so now
Mm,
I'll be one of those. So I'm only doing this aging in
I
place for
loved
myself.
my pager.
I'm selfish because I'm getting to that age where I'm going to need the very technology that I'm talking about. And
Yeah.
paging was the way we communicated. It was a one-way pager. Every doctor had one. And oh my God, you were so lucky if you had a pager. And then they became so mainstream that all the kids had them and they were in
Oh,
colors and
yes. I
Motorola had them
loved
out there. And
mine. Oh,
yep,
it just did. It made you feel, it just
connected.
empowered you when you had that technology. You had that little device on your
Yeah. somebody
Mhm.
could text you and say, call this number, and you
Yeah,
or page you and say, call this number, and you were like, oh my God, now I got to go find another
I
relic,
gotta go find
a
a
payphone, no less, and take my quarters or my dimes and what
phone.
generation you're from. I remember being on sales on the road with a pager and a calling card. You'd get a page, and then you'd go to find a phone booth, and you'd call back on your calling card, and you'd find out who paged you. And then you got really cute. You could start to page little cute numbers like 143s and that kind of stuff. People got creative. And then alphanumeric paging came out, right? So now you could type a message. It was one way, but still I
Oh
could send a
yeah.
message saying, "Hey, pick up milk," or whatever
Mhm.
but that communication vein is where I'm really stuck with, is that it's moving into now from one-way paging to alphanumeric paging, and then it went to two-way. So I launched the first Reflex 50 network with SkyTel, shoot, moons ago in Boston. And that was when you could originate a message from a device. Motorola had a product called Tango. It was a big brick. And we had to set up all the base stations and all the technology behind that ability. So you look at technology and say, yeah, you have to have all this infrastructure, but people don't care about the infrastructure. They don't care about the widget. They want to know that when I text this message, it goes through and it's
Mhm.
confirmed and receipt, and I know you got it. So that's where it really started, was back in just paging. And then I moved into, I'm really aging myself on this one. I moved into Cellular One, which was the first national phone service that
Well,
you
you're
could have.
aging us because I know all of
Yeah,
these names.
yeah. And then you could plug it into your 8-track player, and right then you had all those devices from the time.
You're
But
exactly.
it was again our ability to put a phone in your car, and it was
Mm,
expensive, right? But it was
yeah.
analog, and it was a little scratchy at times, but the service was very expensive. But if you had that suitcase-sized phone, or you had the ability to have it mounted with a pro kit, Cellular One was the first way you could roam around different states without paying roaming charges. So that was the other thing, right? You had a service you had in a local community,
Mhm.
but once you went outside your carrier, there were charges and things like that that
You're
applied. And
educating so many people right now that are watching this. They're
hopefully
going,
they're all old
what?
enough to understand where I am and going, who is this guy sharing stuff I don't understand? But it's an incredible journey that if you now look at cell phones are not
Yeah.
just luxuries, they're mainstays. We get all of our information now through a cell phone. We get everything. What used to be TV, then we had our phones in our wall. It was on a wall in your
Oh,
home,
yeah.
right? And now you can take it with you, and you get your internet, and you get your streaming, and you get your phone calls, your texting. Everything is in one little device with the
And you
computing power of
started
what?
that, and now here you are with the brick in the car, which I remember that too with a friend of
Yeah.
mine. We all came over and surrounded our parents' car, and we were like, oh my
Oh
gosh.
my God, right? But don't use it
Yeah.
because it was $3 a minute, and nobody wanted
Yeah.
to
Oh,
pay three
yeah.
bucks a minute for the phone. And nobody had them, or very elite had them. And then they were mobile, right? Then you had the ability to carry it with you. And then you had texting on these devices. All of a sudden, whoa, I can send a text message from my phone, but it was triple tap or predictive
Oh, yeah.
text or other services that worked their way around it. I actually had a startup out of Cambridge called Digit Wireless, and the founder was former head of ergonomics at Apple. And he actually had developed a keypad that fit in the format in the real estate of the old flip phones. So you could literally use your finger and type back in the day. And we launched a couple of versions with LG and some others. But that was around the time Apple was becoming part of this conversation. Suddenly, Apple was building prototypes. Apple was coming up with this way of entering text into this mobile device. And of course, as QWERTY and touchscreen became the de facto standard from that. But at the time, on your cell phone, you could triple tap predictive text, or you wanted to add data. Well, you had WAP. WAP was so old too. So these are all old, super old technology, and you can get ringtones and wallpapers. Kids today don't understand what a ringtone and wallpapers were. We used to buy them off
Yep.
singular at the time.
Yep.
Shoot, just
That was
singular.
my first cell phone. And I remember because they said I had to sign up for a 2-year contract and I had to like pause for a moment and walk outside because I was like, 2 years. I'm like, I don't even know if I'm going to want this thing.
Yep, exactly. And you had models from everybody. If you saw it at the time, everybody was having cell phones, Panasonic, you know,
Yeah.
LG, Nokia, Motorola. Some of these companies don't even exist anymore. Today we've got Google Pixel, didn't even exist.
Mm.
We're on Apple 17. So you start looking at where we've come from that technology. from that perspective. And now you look at TV evolution, right? It was the big tube. Now it's flat screens. Now you get an 80-inch flat screen for $50. You can go buy these things for next to nothing, and everybody can have one. And that's where we get our information. And they're synergistic. TVs work with phones, and you can
Mm-hmm.
do casting and all kinds of cool stuff now with technology. So I've always been in that disruptive field, always looking for that next big thing that didn't exist and at the same time had an impact on people's lives. Or how do I impact? How do I use technology? I worked with a company that had a way to measure pool chemicals utilizing microfluidics and robotics called Sutro. And people have swimming pools, didn't know how to take care of them. It doesn't seem like it would be a great step on that side, but when you look at it and say, here's another entity that we have, but we just don't understand. But now, how do I communicate? How does the pool communicate what's going on so that I, as the owner, can do the right thing by the pool? And of course, we've all swim in pools where our eyes turned red or our clothes bleached, or
You're
it's,
talking to an old lifeguard, and I had to take the
yeah,
little kit and test the water. Oh
there you
yeah.
go.
Oh yeah.
So we automate all that. So there's that technology piece that really becomes very impactful to people's lives, right? I'm impacting you at a swimming pool. We can impact you at your smartphone right now. And when I first joined, when I saw what HomeSight had, you started to see that, yes, it's a box. And yes, when they first launched it, it was called a smart camera. And of course, nobody wants a camera in their home watching them 24 by 7. So the product has evolved now into a wellness hub, but again, it's a technology that's now impacting somebody, just like the cell phone and the pagers and all those things that got us here, are now able to provide a service that didn't exist and provide that. And you'd be surprised how many folks share your story about you taking care of your loved ones and David taking care of his. And I
Yeah.
can't tell you how many of those folks that I run into that share. And oh, my loved one lives in Florida. How do I communicate with
Yeah.
mom? And then you got multiple siblings that are in multiple cities. Well, how do multiple
Hmm.
siblings get involved? And sometimes they're not always amicable, right? So it's
Oh,
who's doing this, who's doing that, and how do I get all the siblings on a single call? Well, now you could use a FaceTime, but that's not HIPAA compliant. But now I could put all the family on the TV and the doctor and the caregiver and the osteopath and the veterinarian if we wanted to make sure we take care of mom's dog. So we start to give them the tools to be connected and to share information. And imagine you as a caregiver being able to see that dad's weight is okay. And maybe he's
mhm.
diabetic and we got to keep a track. Dad may be dementia. Maybe he's eating too much. We got to make sure his weight stays constant. He might be eating one lunch, skipping lunch, or eating two lunches. We don't know. But how do we use the technology to ensure dad's okay?
Mm.
And imagine as the child being able to see on your phone, yep, dad's weight looks good over the last month. Oh, mom's blood pressure looks good.
Oh
And I don't
yeah.
have to call dad and say, hey, dad, how's your weight? You eat lunch today? And dad go, I'm fine, leave me alone.
Leave
You
me
know,
alone. Stop
nobody wants to
micromanaging
be
me.
managed. I don't
Yeah.
manage
Oh,
me. Leave me alone.
ooh.
I'm still the dad. You're still the kid.
Oh,
And I'm not
yeah.
ready yet to say, yeah, let me give in. But we don't have to do that. We can do it very discreetly with dignity and let them continue to live independently, but somebody is keeping an eye on things to ensure that they are safe and secure.
No, I love that. And kind of go back still to the phone story. It is. It's like what you've been rooted in is what we as a society, it's been this, I know you use the term vain, and that's exactly it because we've wanted, our actions have been to purchase these devices to, as they got upgraded, we were the ones demanding the upgrade, but it was to keep this constant communication and connection. And years ago, I read this book and it was talking about, there was a chapter or two about marriages over hundreds of years and how, like, even like in the early 1900s, that like I think it was they were looking in Pennsylvania that the wedding certificate or marriage certificates, the people met within a 5 block radius traditionally because the form of communication was just
Yep.
right there. And then how it's like communication. I mean, now you can meet someone clear across the world,
Yep.
but it's going back to the technology and how we do now have such a trust and a relationship with it. And I think just like you and I were chatting about that when it comes our turn,
Mm.
that this is going to be something that's almost, we want that
Oh,
expectation.
we're going to have the
Yeah,
smartphone
yeah.
generation is going to demand that type of capability for sure.
Yes, I've been a part of those conversations where you're asking your parents, did you go to the doctor? What is your
Are
weight?
you taking your medication? Yes.
Yeah, exactly. Like I remember some of like the early ons and it was just asking my dad to give me feedback about his appointments or my mother. And it's just like everything is fine. Everything is fine.
Yeah.
Like
Yeah.
I am your mother, you're the child, and that's a hard one to deal with.
Yes. Well, especially when you start getting into more personal things. Hey, Dad, how many times did you go to the bathroom last night? I mean, that's not a question that's easily asked.
And he won't
And
answer it.
but if I could tell you how many times without asking him, and it was very non-invasive, and one thing about it is that technology kind of needs to be invisible. It can't be
Mhm.
standing out in front as a big thing, and that's where a lot of the barriers to adoption to, especially bleeding edge technology, is that they're out in front, and people lead with technology. If you go to CES, if you've ever been to that show,
Mhm.
Consumer Electronics Show, it is a mecca of electronics. I mean,
You're not
I've
kidding.
seen it grow since Comdex up through, again, I'm going to age myself, up through CES now, where it's not even in the booths anymore. It's all over. Every hotel's got suites, and the show is enormous because electronics are such a big thing. But if you go there, it's an in-your-face show. It's a LED flashing lights, 90-inch TVs, right? It's all of those things. But we don't want that in the home care space. We can't have flashing LEDs. We can't have all that type of technology. So how do we be invisible or as invisible as we can be, yet still provide that data and do it in a way that's very much non-intrusive? I don't see things in my home. Like I said, nobody wants a camera staring at them 24/7, but everybody wants the capabilities of having that camera. They want to be able to communicate. They want to be able to see pictures of their kids on their TV. They want to be able to see their kids on an 80-inch TV or their grandkids. Imagine that instead of the little screen. You start looking at that as, but yet I don't want this big thing standing out in front of my house. And technology needs to be invisible. And one of the biggest things I have found in the home care space that differentiates it from any other industry I've ever been in is the people that are in this space. The
Mhm.
amount of empathy that you have in this industry. You go to CES, it's a very cold technology show, right? It's very
Mhm.
cold. You go to a home care show, people are hugging each other. It's
Yeah.
like a whole different world, and it's the people that bring the real value to the technology. Technology can't replace the human interaction. You can't.
Mhm.
I can't have AI phone calls. You have to have people talking to people. Our job is to utilize technology to amplify that interaction. We don't in any way want to eliminate the human interaction. We want to augment it. But give those caregivers, those poor caregivers that are, and I say poor from a perspective of there's not enough of them. They're
Right.
working a lot
Yeah.
of time. They're driving miles and miles to take care of these folks. And God bless them because it's a job that is very unique, I think, from a people perspective. But how do we help them do their job? What can we give them to help them maintain and augment, make more visits
Mhm.
utilizing the same time without having to drive 2 hours to do a blood pressure test. But yet,
Or even when they're there, once they've arrived, is even giving them tools to
yes,
help with their, like we just had this conversation yesterday, and we were actually discussing a friend of mine as a home health nurse, and she has a patient that she's been taking care of for about 6 months or so. And, but there used to be this very strong dynamic, and it's the transition that
mm.
he's sitting on the couch watching the news or whatever, and then she's coming over and it's like, oh, again, or whatever. And she's using music because that was one of the
Yep,
things that she found out that he used to love going to concerts. And so she found a couple of the couple of bands that he loves, and she didn't know who these artists were. And so now when she gets there, that's one of the first things, like he's just like, oh, so she has a portable Bluetooth device now. And so she brings this little
yep,
portable speaker, and they'll start singing, and she's like, yeah, they kind of start doing their shoulders. And so it's completely changed the dynamic. But yet again, it's
absolutely.
going back to using technology to not, it's not taking away from her, it's amplifying her. It's
Exactly right.
amplifying that relationship.
Yep.
So yeah, so no, you're preaching the choir now on this.
Yeah.
A
Well,
thousand
the content
percent.
side, the engagement side is absolutely one of the things we're focused on is giving caregivers tools when they get there to engage. I mean, after they're done with their duties and they've done what they're supposed to do as caregivers, there's time to engage and to become connected. And music being one of them. And we believe wholeheartedly in that. We're working with several content providers to provide the music aspect. Now imagine that now he gets it through his TV. So again, keeping that TV as the central point. They can get exercising through the TV. They can do dementia memory games through the TV so that the caregiver can now interact with the care recipients, but utilizing again the same format and ensuring
Mhm.
that, that their time is well spent and there's some value and not just doing the things they're supposed to do as caregivers, but
Yeah.
creating that personal human
Yes.
touch that is so important.
Yeah. Because it's the connection. I mean, look, we were
Yeah,
just talking about pagers, and it was because that pager, we were connected. When we got that message, all of
absolutely.
us would be hit with a huge amount of dopamine because someone was reaching out to us.
Yeah,
Oh yeah, no, it is.
absolutely.
It's this evolution, and yeah. So I cannot. I knew I was going to love these stories just because it is. When people talk about technology, a lot of people will just like, no, it's just that's not what we do, or that's not what we
Yep,
bring, or that's not what I'm going to be looking for my parents.
yep,
Versus, and I love how you talked about the people behind the devices, behind the software, behind the code that we're a bunch of caregivers ourselves, and all of us
yep.
have had this kind of guiding light that got us here. Like I tell people all the time, like I wasn't born in healthcare. I just got here as fast as I could. So I ask all my guests this question. What is something that, because we've discussed and chatted about a lot, but what is something that I didn't ask that you wish I would have?
I think the future, I think, is really
Mm,
where we want to look at is that here we are today, and as we've talked, evolved quite a bit since the day of the
mm-hmm.
pager. And I think that evolution is going to continue, of course.
Yeah.
Technology is now coming out. The word AI, the acronyms
Mm,
AI is thrown around everywhere now.
yeah.
But again, there's that fear. Technology is not, I think it's great when you look at those things and maybe a business application. But when you start trying to translate them into home health care, I think they have to be translated the right way. And I
Mm,
think we're going to continue to see an evolution in our world. And I think within the next 5 years, I think you'll still see the need for that video component. But I think the sensors will become more accurate. I think you'll see more opportunities to expand capabilities, right? Now we're doing blood oxygen, glucose monitoring. What are we going to do tomorrow, right? Yeah, right.
yeah.
Apple Watch is an example of
Yep.
now all of a sudden you can get what you want, right? Fall detection. How do I get in front of fall detection? So it's not detection, it's prevention to mitigate
Yeah.
prevention. I think those sensors and those types of technology. I went to a show that started to talk about footwear, where people started to be able to wear footwear that could detect how they walk and pre-mitigate a fall. Or imagine now a fall is detected, a lens opens to make sure, oh, are you on the ground? Are you okay? Did you just trip? We don't want a false EMS response, but we want to make sure that if we're going to respond, we respond. But now, oh, I can unlock the front door automatically. EMS can just come in without breaking it down, and we have a pathway. And I think those are the things you're going to start to see as platforms become integrated. AI now can take this huge data library that we'll provide through the sensors and create recommendations, create ways that caregivers can be proactive. And I think the future is exciting. And we're here today looking at something that's still fairly analog, comparatively speaking. But things like AI are becoming so amazing. And I don't want to overshoot AI. I think a lot of people use it for the sake of saying it. But I
Mhm.
think AI in healthcare needs to be very careful because we have
Mhm.
doctors for a reason. Now, AI might help make a recommendation that a doctor forgot or didn't see, but I don't think you're ever going to see us replacing that doctor in the near term or that caregiver in the near term.
Mhm.
I certainly don't want an AI bot
Great.
talking to my grandmother. I want a human that can interact and be empathetic to somebody who's sad or happy. AI does not have emotion. And I think
Yeah.
caregiving is nothing but
Nothing
that
but
emotional
zero.
connection. Yeah.
So going
So
back to Jim of the pager day, what advice would you give yourself going back to that first day when you were walking in and like, I work for this paging company?
Wow, it was Page, New England. It was
Page New England.
a little paging company up in Danvers, Massachusetts, where I walked in and I was the branch manager. And we had trays of pagers, and we would go out and sell them to, if you remember back in the day, there were resellers for paging on every street corner. It was an amazing journey, and I just never realized that how impactful. At the time, it was technology for the sake of technology. We talked about paging waves, 400 megahertz or the 150 megahertz, and that's how we compared ourselves to people like PageNet and at the time, right? We talked technology. We didn't talk communication. We didn't talk connection. And I think that's the biggest advice is that I think I saw technology back then as just that. It was
Mm.
technology. Now it's how does technology impact, and it could be any technology, by the way, it's not
Yeah,
just us.
yeah, yeah,
But look at anything that's out there now. Smart, who thought a thermostat could now be smart? Now a smart thermostat we take for
yeah,
granted in a home,
yeah.
right? It's included, great. No, imagine a dementia patient doesn't understand and turns that down and we can adjust it remotely to make
Mhm.
sure that environment stays safe. I think that's the real jump was from technology for the sake of technology.
I love that. That's some great advice to give your younger self if you could, is that
Yeah,
to not look at technology as just that, but it's
yeah.
communication.
And
It's
stay in school. Stay with your
impacting
parents as
human
long as you
behavior.
can. Don't leave your parents' house. Stay there. It's cheaper. Go home. Stay home.
Oh, it's funny because we're talking about like our elder parents, and then I'm talking, and then I have a 19-year-old, and it's like, oh my goodness, if I could just tell you, yeah.
Yep.
Oh
And it's
yeah.
funny because it's all repeatable because it's
Oh
don't buy that
yes.
fancy car. Well, my son,
Oh,
hey, I'm going to buy you this Volvo. It's $1,000, but it's reliable. It'll get you through. Didn't want it, had to have a sports car, broke down, cost him money. Yep. Now he looks back and goes, Dad, you were right. And you go, they don't think we know anything and nobody can pass
yeah.
that down, even though we've hit the potholes already. How do we help navigate them? But parents don't know anything. Kids don't know anything when you're aging parents either. So.
Oh yeah. So it is, it's this domino effect of nobody knowing anything.
Exactly right.
One thing that my son has always grown up is when people would say like, "Oh, your mom loves you so much," and all of this, and he was like, "Well, yeah, everybody knows that." And I'm like, when it comes to being a daughter or a child or being a mother, it's what really makes us, what really shows that is that every day we get up and we try again. We try again for our aging parents because we're going to get it right sometimes and we're going to get it wrong. It's the
Yeah.
same thing as being a parent ourselves, is that some days we wake up and we've got it right and then some days not so much.
Yep.
But what makes us these good children and good parents is that we're going to wake up tomorrow and keep trying
Yep. And do it again.
and
Yeah.
stuff. Yeah. So I cannot
Absolutely.
thank you enough for joining us
Oh,
today.
thank you. Thank you for having us and for this conversation. It was quite unique, not comparatively to a lot of the conversations that I have.
Oh, well, I'm honored by that. And just like I said, it was like I knew this conversation because it's a topic that people sometimes kind of turn off or they think they
Mm,
already know it and stuff. And so I think we hit on a lot of pieces that I think are going to start conversations.
yeah.
And
And you hit on one thing that's important is that people don't know what's available to them to help them be caregivers. A lot of folks are thrown into that caregiver role. They don't know what to do. They don't know how to. They don't know how to deal with it. They have their own lives and their own kids, and now they got their parents on the
Mhm.
other side. And they don't know what technologies could help them. They don't know what tools are available to help them. So education is getting this in front of the families early so they can get
Mhm.
mom and dad up and running early while they're still ambulatory in that journey, as I started to share with you. Get them accustomed to it. They might not be ready for in-home care. They might not be ready for any of that other thing.
Mhm.
But let's open that communication line up. Let's ensure that loneliness piece is
Exactly.
not going to be a factor in this thing. And then we can add pieces and parts as need be. But education, getting it in front of the families to
Mhm.
know that there are things that can help them take care of their loved ones and reduce some of that burden that they might be feeling because it is
Yeah,
hard, especially if they're not in the same state. They can't get there
completely.
and if they can, You got to be there every Saturday, right? That takes away
Yeah, and
from.
that's the thing is that it's not for a lot. And I had this conversation a couple of months ago with a gentleman on the podcast, is that a lot of kids, a lot of adult children feel that, well, I'm giving up, or even spouses, I'm giving up. And it's not you're giving up anything. You're just adding to your care team. You're
Yeah,
adding to your toolkit. You're not taking anything away by doing this. You're not sacrificing
absolutely.
anything. You're gaining so much more in doing these, in making these calls. Yeah.
Absolutely. Yeah.
Yeah.
And the more
Well,
touch points we can have, the better. I think
yep,
that's the more
exactly.
communication we can have, the better we can
Yeah,
go
now
forward.
I wish I would have kept my pager.
Well, I have one in the garage. I think I have a couple left over from the days. Because my
All
daughter
right,
will look at it and go, "What the
everyone.
heck is that?" Yeah, that's
Oh, well,
okay.
Jim, thank you so much.
No,
And
thank you.
thank you, everybody, for joining us for another episode of Coro Chronicles. And I hope you have a wonderful day.